Thanks so much for checking out this video. My name is Dr. George Dresser. I'm an internist. I've been in practice for over 20 years, and I'm really glad that you decided to check this video out. The reason I decided to make some of these videos is that I find time is so limited in the clinic setting where I'm seeing my patients. I have so much that I want to tell them that I think is helpful for maintaining good health. And so I'm hoping that these videos will be very useful for patients who are struggling with some of these healthcare issues. In my clinic, I spend most of my time trying to prevent cardiovascular illness, treating high blood pressure, and really just trying to prevent vascular problems before they happen. So thanks again for joining us. If you like this video and you want to see more, please subscribe. And if you click the bell, you'll be notified when I post more content. Thanks again. Okay, so the title of this talk is Should Doctors Stop Measuring Blood Pressure? This video is intended for anyone who's been told that they have high blood pressure. It's intended for anyone who knows someone, either in their family or a friend who has high blood pressure. And it's also intended for healthcare providers who want to do a better job of both assessing blood pressures but also educating their patients about how to do blood pressure measurement properly. So the first thing we're going to talk about is why we measure blood pressure. We're going to talk about why measuring blood pressure is actually very hard to do well. We're going to talk about what type of blood pressure measurement correlates the best for predicting long-term risk of heart failure, strokes, kidney damage, heart attacks, that sort of thing. And what I'm going to tell you, bottom line, is that in fact, if you can get your blood pressure measured while you're sleeping with an ambulatory blood pressure monitor, that data correlates best with long-term risk. Second best is daytime or awake blood pressures measured outside of the clinic setting. So either with an ambulatory monitor or using really well done home blood pressure measurements. Third best is probably a carefully measured blood pressure in the clinic setting. And then worst is a poorly measured blood pressure in the clinic setting. And the reason I titled this talk, Should Doctors Stop Measuring Blood Pressure, is I really feel strongly that we should stop measuring blood pressure poorly in the clinic, because more often than not, we make the wrong choices about how to help patients if we don't measure blood pressure correctly. We're then going to talk about the mechanics of how to do a good measurement of blood pressure using a home blood pressure monitor. And then one of the most important things, I think, is what to do with these blood pressure measurements. There's no point in having a whole lot of data and not knowing what to do with it. So we're going to talk about what you should be doing when you get those measurement results back. The first thing to think about is what the process is when we are caring for patients who have high blood pressure. It's important, given how common high blood pressure is, that patients be screened. And so, there's a lot of efforts at measuring blood pressures here and there, and you'll often find, even when you go into your family doctor's office for something else, that they will do a measurement. And it's important that we are doing a lot of measurements to try to capture those things. But once you've identified that the blood pressure may be elevated, then it's very important, the next step to determine if that blood pressure is high enough that it's going to cause harm to your patient is very important. And doing that properly then allows us to fix the things in a patient's life, like how much salt you're eating or if you're not getting enough exercise. If the blood pressure doesn't come down, then we use medications. If you're using medications, then it's very important to follow up on the blood pressure to make sure that the blood pressure actually returns to a normal level. And then only by doing that can we then expect to prevent heart failure, strokes, kidney damage, and heart attacks. It's important to remember that if we get the first step right and we identify patients who may have high blood pressure, that's not good enough. Because if you do a poor job determining if the blood pressure level actually is associated with harm, then you don't get any other parts of handling a patient who has high blood pressure correct. And that's where I think we probably do a lot of things in our healthcare system that are not helpful and perhaps expensive for no reason. Before we had blood pressure measurement devices, there was a sense among people that provided healthcare that having a weak pulse was a bad thing. That, shortly before people die, their pulse disappears. And this concept that having a weak pulse was a bad thing was part of what drove people to want to be able to actually measure the actual level of pressure in the blood vessels. So fast forward, the first good mercury blood pressure monitor is invented, and we're able then to measure blood pressure in a whole lot of different settings. So what I have here is a graph of what the systolic blood pressure, the top number, would be across a population of people. And what you can see from this is that the highest peak, if you like, of people have pressures in the range of about 100 to 130, that sort of thing. What you'll notice is that the tails disappear very quickly. And so, you might say, well, where are all the people with pressures at the low end? Well, in actual fact, they're dead, because having a low blood pressure too low results in death. You look at the other end, and again, when you get pressures up above about 160 or so, the tail drops off very quickly. And again, the question is, why is that? Well, the reason that happens is that those people are often dead. And so now we have a way of predicting who will be dead. Now, obviously, there are some things that happen before you die, like you get heart failure and that sort of thing. But we have this incredible tool, this ability to measure a number that predicts what is going to happen to the patient. And so it's a great tool, and that's why we've continued to measure blood pressure ever since the first mercury sphygmomanometer was invented. We've been doing this. The trouble with measuring blood pressure is that it is extremely variable. There are so many things that affect your blood pressure level. And one of the ironic things about blood pressure measurement is one of the things that has the most dramatic effect on a blood pressure is attending a healthcare setting, going to a clinic. And so this graph I have in front of you is actually the output from an ambulatory blood pressure monitor from one of my patients. And what this device does is that you strap it on correctly in the clinic, and it's a small deck of card-sized device with a tube inserted into it. You can put this in your purse, you can put it on your belt loop, and you just walk around with it all day long. It measures blood pressure automatically, and then at nighttime you can leave it on, set it by your bedside, and it will continue to record blood pressures while you're sleeping. So what you can see from this graph is that when my patient first had this device put on, her blood pressure in the clinic setting was well above 200 systolic. But as soon as she left that setting and left me with my white coat on, her blood pressures actually came down quite nicely. You can see during the daytime hours while she was sort of doing her things in her life, that the lowest measurement we got was about 100 systolic, and the highest was about 160 systolic. And when people do these, they usually fill out a diary to say what they're doing at different times so that we can try to correlate activity with what the blood pressure is doing. But the point of this graph is that blood pressure is exceptionally variable. And so if you were to go with, for example, the lowest measurement, 100 over 60, and try to correlate what that does to her long-term risk, you probably wouldn't get very far. If you use the highest measurement, the 160, and then looked at sort of what happens to her down the road, that probably wouldn't correlate very well either. But this allows us to generate average pressure measurements over a daytime and average pressure measurements over a nighttime. Now, when they've looked at how these correlate with long-term risk, we have been able to make draw some conclusions, if you like. So this graph, not to belabor the science behind this, but this graph shows the relationship between nighttime blood pressure on these ambulatory blood pressure monitors, the 24-hour results, the daytime results, and then a clinic measurement that's done carefully. And what you can see from this graph is that the nighttime blood pressure while you are sleeping correlates best with long-term risk. Next to that, the 24-hour results from an ambulatory blood pressure monitor seem to correlate best with results. Next to that, a daytime measurement, whether it's measured by an ambulatory blood pressure monitor or by a well-conducted home blood pressure measurement, is the thing that correlates well with future risk. And below that is clinic measurements, whether they're done well in this study, or worse yet, if they're done poorly, do not correlate with long-term risk. And so the reason that doctors should stop measuring blood pressure poorly is that it doesn't help us predict long-term risk. It doesn't help us predict whether we ought to be changing medications or telling a patient to drink less beer or eat less salt. It really doesn't help us at all. So there's no point in doing poor clinic measurements. What I want to talk about now is how to measure blood pressures. And I'm going to start by talking about the monitor that you may want to choose. So really this part of the talk is designed for people that want to do a really good job of home blood pressure measurement. So that if you don't already have a monitor, then the first thing you need to think about is what features you want. And basically, the big division here is, do you want something that will connect to your smartphone and save you some of the trouble of steps in home blood pressure measurement, or do you care about that? You can get very good blood pressure monitors that are not fancy, they don't connect to smartphones, for about $50 or $60, and they do a good job of assessing home blood pressures. You can spend $150 or more for fancy home blood pressure monitors that will also record the blood pressure well, but may have some additional features like automated recording, saving the numbers, transferring them over Bluetooth to your smartphone, that sort of thing. Some companies are even looking at the possibility of uploading blood pressure information into the cloud so that that information could then be sent directly to a family doctor's office, for example. So there are some other things that are in the works right now, but the bottom line is think about what features you want. If you are willing to write down your own numbers, and either just bring that sheet in with the numbers or make a printout for your doctor, that's perfectly acceptable. That will work well. There are a number of reputable sites that have validated, if you like, different blood pressure monitors. I'm a member of the Hypertension Canada Recommendations Task Force for Blood Pressure, and on our website there is a very good series of blood pressure monitors that you can check out to see if there's one there that meets your requirements. I'll put a link below for those of you that want to check that out. You probably want to get a home blood pressure monitor that allows you to check the blood pressure in the brachial artery. So you want one on the upper arm. There are devices that will do wrist measurement. Again, it's a bit harder to make those machines do a really good job. And so if it is possible to get one that fits well on the upper arm, my recommendation would be to do that. There are some people, because of the shape of their upper arm, where it's hard to get a cuff to sit properly. And for those people, the wrist monitors are an option. But in general, you're going to get more reliable results out of an upper arm or brachial artery measurement. The next thing you need to do when you pick up your monitor is make sure that the cuff fits. And really at the point where you're buying it, if there's a pharmacist around, it's not a bad idea to take it to them and say, can you just double check and make sure that this fits properly? If they can't do that for you, or if, for example, you're buying the device online, then take it into your family doctor after you get it and make sure that the cuff size is correct, because one of the most common errors with home blood pressure measurement is using a cuff size that's too small, and then that gives you falsely elevated readings, which of course can be a problem. You should get a device that inflates itself automatically and deflates itself automatically. You do not want to get one of the devices where you have to inflate it yourself with a little rubber ball. The act of pumping the rubber ball makes the blood pressure go up, and so you won't get an accurate reading if you use that. The other thing I would recommend if you're looking for home blood pressure monitors is if you could find one that actually has a 5-minute countdown timer. That's a very helpful device on the machine, because you need to have a 5-minute countdown once you're set up to do your measurement. So think about that. The other feature that you may want to consider in home blood pressure monitors is that there are now some that are programmable to record a blood pressure at a specific time. And given that sleep time measurements are very useful, one strategy that you may consider is to get one that you could set to record the blood pressure while you're sleeping. Go to bed with the thing attached, and then see what kind of data you get from that. So that's another thing to think about when you're making a home blood pressure monitor purchase.
Okay, the next thing I want to talk about is how to set yourself up to be successful measuring home blood pressure readings. The first point is make sure that you do it when you have the time to do it without being rushed. If you are rushed, you will not do a good job of recording your blood pressure. And bad data in this case is worse than no data. So really, if you don't have the time to do this properly, find another time. Make it a priority some other point in your day. When you're getting ready to measure your blood pressure, you need to make sure that you're comfortable. So, if you need to go to the bathroom, empty your bladder, that sort of thing, do that. If there's anything particularly bothering you at the time, you need to sort of deal with that. For example, if you have a lot of pain, it's not unreasonable to take some pain medication. If you have back pain or something like that, make sure that you've set yourself up in the best way possible. You then need to sit comfortably in a chair that has a firmly supportive back, and you need to be prepared to sit back in the chair so that you are comfortable. Your knees should be bent. Your feet should be flat on the floor. You should not cross your legs because that will have an impact on your blood pressure. You need to place your arm so that it is comfortably supported with the cuff at heart level. You need to place the cuff on whichever arm is more comfortable for you to set it up, with the caveat that if you have a discrepancy in the blood pressure from arm to arm, then you should generally be using the arm with the higher pressure reading. So how do you know this? Well, the first time you see your doctor for high blood pressure, one of the things that the doctor should be doing is checking the blood pressure in both arms, and then notifying you if there is a difference from arm to arm. If your doctor hasn't done that, you can check your own blood pressure arm to arm with your monitor and see if one is reading a little higher than the other. If it is, then you should also notify your doctor of that finding. Higher arm, but make sure that it's comfortable for you to apply the cuff on that arm. If you've recently had, an injury or something like that, then you probably don't want to be using that arm to measure the blood pressure. The cuff should be snug, but not uncomfortable. When we do it in the clinic, generally we want to be able to slide one finger kind of in between the cuff and the arm, without too much resistance. If there is an artery marker on your cuff, make sure that the artery marker lies over the area where the artery should be, and that is just on the inside of the biceps tendon. So if you need to find your biceps tendon, if you just flex your forearm, then you should be able to see the tendon. And then you want the artery marker just on the inside of that tendon. Once you're positioned in your chair, you are going to power on your monitor if it needs to be powered on. And then the most difficult part of this whole process is that you then need to sit quietly for 5 minutes. And honestly, you need to make sure that it is 5 minutes. My recommendation during this time is that you think about pleasant thoughts, things that you're grateful for in your life at this moment. Meditate, whatever you need to do to relax. Do not use your phone, even if you're playing games on your phone. That could have an effect on your blood pressure. So please don't use your phone. And ideally, your phone shouldn't be around you, or it should be silenced so that it's not interrupting the flow here. Do not talk to anyone during this 5 minutes of rest or while the blood pressures are being measured. Don't be talked to by anybody around you. So, if you have somebody around you that tends to talk to you when you're sitting there, then you may want to do it in a different location, or just ask them to leave you alone for 5 minutes. Really, you need to feel bored, and that's the ideal setup to get good readings. Okay, after 5 minutes of rest, we are going to activate the inflation of the cuff. While the cuff is inflating, we want you to think about your breathing. Just gently in, gently out as the cuff inflates and then deflates. You need to make sure that you relax the muscles in your arm and don't move. If the device detects movement, or for example, flexing of the muscles in the arm, then it may error out, or worse yet, it may give you a false reading. But if you're getting errors, then just try to be very, very still, relax the arm. Don't be anxious about what those numbers are, no matter what they are. Honestly, one of the saddest things is when patients say, I felt perfectly fine, but I checked my blood pressure and it was, 160 over 100. I felt very anxious about that level. I checked it again, it was 170 over 110. That made me even more anxious. And so I checked it again and then it was 180, over 120, and I went to the emergency department. And really, that's defeating the purpose. So don't worry about what the numbers are, just write them down. And then you want to write the numbers down, then activate the cuff again to get another measurement. And again, just think about your breathing. The time frame between the first measurement, writing it down, and then the second measurement is usually about a minute, and that's reasonable. If the second number that you record is more than 10 points lower in the systolic or top number, or 5 points in the diastolic, then write the second number down and then plan to do a third reading. If the numbers are within 10 over 5, then you're finished after 2 readings. Just write those 2 numbers down. If the third number is closer to the second number than the first number was, if you happen to do 3 readings, then take the second and third reading. You're going to take an average of those, and that average number constitutes 1 recording of your blood pressure. Okay, some thoughts on when to record a home blood pressure. So you should only measure your blood pressure when the information that you get from your monitor is something that you are going to use, or your doctor is going to use, to make a positive change in your life. So if you need to get an average of a number of readings at home, if that's what your doctor has asked for, what we generally think is about 14 readings spread out over a 7 to 10 day period when it is convenient for you to do it. It generally is very good at approximating what one of our ambulatory blood pressure monitors would give us as a daytime reading. It is best to get a series of readings after either before or after you're making changes that you think may have a beneficial effect on your blood pressure. So for example, let's say that you've decided to change your diet around and eat a little less salt. Well, you do a series of readings before you make the change, you do a series of readings after you make the change, and then you can evaluate for yourself, did my change in diet have a beneficial effect on what my blood pressure was doing? if you change your exercise routine, if you reduce your alcohol intake, do a series of readings before and then after. The one thing about alcohol is that if you binge drink, your blood pressure will generally be highest the day after you've had a binge. And that can have a very dramatic impact on your blood pressure. So I hope if that's happening to you that you would consider moderating your alcohol intake. The other time when you should check your blood pressures is if you've made a change in your medication. Now, what I tell my patients is that after you've changed your medications around, it usually takes somewhere between 1 to 3 weeks for those changes in medications to really have an impact. And so I tell my patients, if they're feeling fine, you don't have to check it right after the change in medication. Maybe wait 2 to 3 weeks and then do a series of readings to see whether the change has really benefited you from the perspective of what your average daytime blood pressures would be. When you are considering what time of day to check your blood pressure, what I recommend is that you do it, the 2 times that are most necessary are right before you've taken your blood pressure medications to get whatever would presumably be the highest pressure in your day, and then about 4 hours after you've taken your blood pressure medication, because for many medications, if you're going to get sort of an immediate effect of the med, it'll happen in that sort of 2 to 4 hour range. So getting some readings at those times is important. Otherwise, just spread them out. The one thing that's obvious is that if you take your medications at bedtime, then getting that 4 hour after the medication is going to be difficult because hopefully you'll be sleeping. And so you don't have to worry about it in that setting. But then what you would want to do is check your blood pressure first thing in the morning with evening dosed medications to see, how low does it go in the morning. If you are feeling unwell, and you have symptoms that could be because of your low blood pressure, so you're dizzy, lightheaded, that sort of thing, then obviously check your blood pressure in that circumstance. And if the blood pressure is low and you're feeling unwell, then that's a reason to seek medical attention, to talk to your family doctor about, maybe you're getting more medication than you need. On the other hand, if you have symptoms that could be from high blood pressure, so headaches, flushing, the sensation of your heart beating in your chest, anything else that seems unusual, check your blood pressure. If the blood pressure is high on your home monitor and you're having symptoms, then again, you need to talk to your healthcare provider to make sure that positive changes can be made. Okay, finally, what I'd like to do is talk about what to do with the results from your home blood pressure measurements. So, the first thing is to show those readings to your doctor when you go see them, and especially if the purpose of the visit is for a blood pressure check, then having a series of readings for the 7 to 10 days before that visit and then showing the doctor those results is the most important thing you can do with a home blood pressure monitor. I've actually taken to not measuring blood pressure in my clinic, which is primarily for seeing patients who have high blood pressure, if they bring in a good set of home readings, because I know that the clinic measurements that I do are not as valuable for predicting long-term risk as those measurements that are done well by a patient on their home monitor. And so in some ways, having a great set of blood pressure readings from home can actually save you time in the doctor's office. Something else that you want to do with your home readings is you want to compare them to what your ideal target blood pressure should be. So you can discuss this with your doctor, but generally on home measurements, we recommend a target blood pressure somewhere between about 120 and 135 in the top number. And so you should have an idea of what the best target for you would be, and then you can compare your home readings to that personal target blood pressure. Once you've established that your blood pressures are pretty well where you want them to be, you can stop measuring your blood pressure. So I have some patients that bring in, months and months of readings, and they feel perfectly well, their blood pressures are perfectly at target. If that's the case, my recommendation to you is that you pack the monitor away. If you become ill, then obviously you can check your blood pressure again if you're not feeling right. Or if something changes, your salt intake changes, your alcohol intake changes, you start an exercise program, then obviously check your blood pressure, see what they're doing. But once you've established that they're okay and that you're feeling fine, you don't need to continue to monitor your blood pressure every day. Just wait until you're scheduled to see your doctor and then do 7 to 10 days of readings right before that so that they've got something good to look at. The last thing you can do with your home blood pressure readings is look for patterns. Try to determine for yourself what affects it on a day-to-day basis. So, if you have chronic back pain, is it higher when your back pain is worse, better when your back pain is better? If you eat pizza the day before, does that have an impact on your blood pressure levels? How much alcohol can you consume before it starts having a negative impact on what your blood pressures are like? Does sleep quality affect your blood pressure? So on a day when you've had a really good rest, is your blood pressure better than on a day when you haven't been well rested? What's your blood pressure right before you take your medications? What is it after you've taken your medications? This information is very important for your doctor in terms of deciding what type of medications to use. Does talking to your mother-in-law or, having a difficult conversation at work have a negative impact on your blood pressure? So all of these things can be helpful information. And if you do establish any patterns in what you're seeing, then it's very important to discuss that with your doctor as well. Thank you very much for watching this video. I hope it was helpful for you. If you enjoyed the video, please subscribe to the channel. Ring the bell if you want to be notified when more content is posted. If you have any specific comments or questions about the material that was presented, or if you have other ideas for videos that you think would be really helpful, please leave a comment below. And when I'm preparing more content, I will certainly take a look at those comments and use that to help direct what gets posted on this channel. Thanks again. I hope you have a wonderful day.
Dr. Dresser does not wish to take any responsibility for his opinions expressed in this video. Nothing in this video should be considered a therapeutic or diagnostic recommendation. If you are one of Dr. Dresser's patients and wish to be considered a good one, please adhere to everything in this video with religious fervor. If you are not one of Dr. Dresser's patients, please discuss these ideas with your healthcare provider.